our next guest. Pam, how you doing?
Hi, Cliff. How are you?
Good, good. Thanks for calling.
Thank you.
Mm-hmm.
Cliff, I wanted to say I'm just so grateful for this show and the information you all provide. And regarding the veteran privatization, so to speak, Cliff, I just wondered, have the guest contacted Senator Tammy Duckworth? Because I believe she serves or either chairs the Veteran Affairs Committee.
Mm-hmm, mm-hmm.
And I was always concerned, Cliff, that when there was some issues with the medical attention for the veterans, instead of trying to privatize, they needed to shore up what already existed. And my concern was to have a commander-in-chief, no matter the party, Cliff, but just to have a commander-in-chief that was concerned about all veterans. And now I don't have a sense of that. So hopefully Tammy Duckworth can do something about this privatization, and we can get the money where it needs to go so that our veterans could receive the services that they need. Cliff, they should have what they need and what they want. That is the least that this country can do for our veterans and those currently serving.
Well stated, Pam. I appreciate you. Thank you so much. That's very good. That's a perfect call by Pam. America's Heroes Group Roundtable with Veteran Affairs Healthcare. We are pleased now to have our guest is Dr. Clinton Leo Greenstone. Leo is Deputy Executive Director of the Clinical Integration Office of Community Care, Veterans Health Administration, and Assisted Clinical Professor of Medicine at University of Michigan Medical School. And the discussion is about, you know what, this major problem that's going on, and he's going to give us some good information relative to updates. Leo, how are you?
Hey, Cliff, I'm doing well. Thank you so much for having me on and all that you do.
It's great to have you on, and that's why we have you on. All you do, Doc. This is great. You know, we had to think of you right away with this situation that's going on. Yeah. Tell us what we need to know.
Well, you know, I think it's so important that all of us need to take this so very seriously. We're seeing the news, we're hearing the stories, and you know, I'm most concerned because of my job about caring for veterans. And as you all know, veterans tend to have more medical conditions and mental health conditions than the age-matched non-veteran population. And so we are very concerned about our veterans and wanted to make sure that we had a very vigorous and robust response from all of us in VA Central Office. And there's great information that, you know, our colleagues have put together. So please go to va.gov. The first thing you will see is information about coronavirus. It has a frequently asked questions, FAQs, which is incredibly helpful for veterans to go on and get a sense of what they might be able to do, where they can get resources, what to do if you have an upcoming appointment, what are the criteria for testing. And it's so important, Cliff, because we've had about 1,300 veterans tested. About 130 veterans to date. This is data from yesterday. 130 veterans around the country have coronavirus. Thankfully, some of them are at home in quarantine. Some of them are in the hospital. Okay, and unfortunately,
and this was yesterday. This was just yesterday.
This is data we have from yesterday.
From yesterday, Leo.
Data.
Yeah. Okay.
That's right.
Gotcha. Mm-hmm.
So just wanted to know that we are providing testing. Some medical centers have testing. Everybody who wants to go to one of the VA centers, you will be screened at the door to make sure you're not having symptoms that will require them to take you immediately into testing. But we really want veterans to call in. We have online capabilities. We have My Healthy Vet. You can get a telehealth appointment. That means we can do it on the telephone. We can do it over your computer. And many people like me, as a provider, I have clinics set up on Monday to do video visits with veterans. So we are really have been leaders in telemedicine. We want veterans to be able to stay home and communicate with doctors and health professionals, and then give you advice if you need to come in. So that's just the basics, Cliff, and I'm happy to take other questions, but just wanted to make sure people understand how serious this is and the responsibility all of us have at decreasing the spread of this virus.
You know, this is amazing, the various ways, Leo. Give us those ways again. People can be tested. Telephone.
That's right. So,
yeah. Mm-hmm.
That's right, Cliff. This is really important. So
Yeah.
just va.gov, you can go right there. There's the public health response that the VA is taking and frequently asked questions. For testing, we really want veterans to be able to call in. We have beefed up our call center capabilities around the country. I can't say it's going to be perfect, but we've definitely beefed it up because we want veterans to know that they can call in and get advice about where they can go to be tested. You can actually go online. So many veterans have accounts called My Healthy Vet. So on the bottom of va.gov, there's My Healthy Vet. You can go in and log in, and you can send email communication to your primary provider if you're getting primary care within a VA medical center around the country. You can also use that to request a telehealth visit, right? And during that telehealth visit, they can screen you for symptoms and signs and give you medical advice as to what you can do at home or if you need to come in and be seen and how to make that happen. So that's critically important that veterans have that information readily available to them, and our website provides that.
That's great. It really is. Call-in number to speak to this great gentleman, Leo, as he likes to be called, Dr. Clinton Leo Greenstone. Our number here, of course, 312-374-8130, 312-374-8130. You, of course, are more familiar than 99% of the people as to what has been going on since this has become so public, Leo. Give us what you think. What is going on? What's the progress that's being made? Or hopefully don't tell us there isn't any.
Well, there is progress. You know, Cliff, one of the things that is so critically important is testing. And we've been a little bit behind the eight ball, as you all know, in getting testing out there. Now, the reason testing is so important is when you have any kind of an infectious disease, public health crisis, you want to know where you have people who have this virus who could pass it on to others. And you want to be able to identify these hotspots. You want to be able to contain these hotspots. And as you know, several states like yours and mine and out in California, New York, these are some places now we're seeing higher numbers. And if you need to know how many people and where they are, so you can actually do appropriate kinds of quarantine, appropriate kinds of containment. And so knowing the denominator, if you will, of how many people are infected really helps you understand what to do with them and how you can contain it from moving forward because you know where it is and you know who's got it. So that's why testing is important, and we've been behind. You know, in South Korea, Cliff, they were doing 10,000 a day, and we hadn't done 10,000 last week. So we've been behind the eight ball, which then allows more spread to take place because people don't know that they may have it and could spread it.
And why is that?
You know, it's an important question, and it's hard to give you the definitive answer. There are things that we've heard that perhaps our government did not respond as quickly to some offers from the WHO, the World Health Organization, who had some test kits. We may not have thought they would have sort of take off at the rate it has in this country, and we're behind in doing that. But I can tell you this. We have increased testing in the past week. We do anticipate the testing will increase. We need to make sure the right people are being tested. So you don't want to say, oh, I was near somebody who may have had a cough. You know, you want to test the people who have symptoms, right? Because since we don't have that many test kits, you want to know the people who truly have a high incidence of or likelihood of having the condition. Fever, typically over 100, 100.5 or so. You've got a cough. You have fatigue. These are some of the shortness of breath, right? Because that's one of the most dangerous signs because, you know, people are dying, Cliff, from not getting enough oxygen into your body through your lungs because this virus impacts the lungs preferentially, right? And inhibits, therefore, the lungs from getting oxygen in and getting the oxygen into the bloodstream because it has virus in there, it has pus and other things that interfere with that oxygen from getting to the bloodstream. And therefore, the rest of your tissues can't get the needed oxygen. The heart, the brain, the kidneys, and then you end up having the whole system breaking down. So we really, really want to find people who may have a cough, shortness of breath, fever. We need to test those people 100%.
And once those tests are done, Leo, what happens after that?
So there are several things you want to do. Some people may be stable. They may not have underlying conditions, Cliff. They may not be elderly. They may be able to ride it out at home. So the veteran here in Ann Arbor, where I live, who has corona, was quarantined. One was quarantined at home, but I've got another one sick in the ICU. So if you know it, we can quarantine you at home to try and prevent you from needing to come in, use some of the equipment that we have, and you want to save it for those veterans who really need it. So the key thing with testing is, then what do we do? Are you sick enough that we should really bring you in the hospital because we're worried that we have to do everything possible? Or can you go home safely and stay in touch with us? Mm-hmm. So we need to know how to guide those veterans. And remember that if you are sick in the hospital, there's some evidence that some of the medications that have been used for other conditions, like malaria, there's something called hydroxyquinoline, and that has actually been shown in small early studies to potentially have some impact at decreasing the amount of virus. Therefore, you can't spread it, and it's not going to continue to infect more and more of your lung tissue and may save patients. And there's another antibiotic that they've been using with it in combination to see some evidence in Europe of some benefit. So it is quite likely that if someone was really sick in the hospital and not doing well, we might be able to offer them treatment that hasn't been proven for corona. But boy, if you're that sick and you're on the edge, that's an important ethical decision with a patient and a doctor to talk about the ability to try something that might be helpful. Because otherwise, we do not have proven therapies to treat this virus. So we have to potentially offer unproven therapies that have shown some promise.
There have been, as you certainly know, Leo, some major problems that are going on. What are you pleased with the progress that's being made?
Well, I think the rate of the progress has maybe been slower than some of us in the health industry would like to see. Mm-hmm. That means ramping up the ability to have protective equipment for providers. Just like you and my brother who served this country and actually had the courage to do so, there are my colleagues out here who have the courage to go out there and take care of people who have this condition and put ourselves in harm's way as well. And at least we need to have protective equipment. So there's been a limited amount of protective equipment, masks, N95, special kinds of masks, other kinds of protective equipment, making sure we have ventilators and oxygen to give to patients. So we've been a little bit slow in this country to push for those things and have them readily available everywhere in the country. We're coming along now, just like the testing is now ramping up, but we've been a little bit behind. So we're doing the right things. We've just done some of them a little bit more slowly.
We are always told to call you Leo. Clinton Leo Greenstone is your real name. But tell us who your brother is.
So Ernesto Dos Reyes Borges Jr., my dear brother,
who is one of our regulars. Yeah,
absolutely.
That's great. Okay, but hopefully, because we've had you on before, and you've given us some great information. If anybody wants to ask a question, 312-374-8130 is our call-in number here at the station. So, based on what is going on now, what is the Commander-in-Chief doing? I don't want to talk politics. I just want to know exactly whoever's going to be there is going to be there, and that's what we need to know.
That's right. So, the Commander-in-Chief is doing a better job at this, letting Vice President Pence, people like Tony Fauci, the leadership who, even in FEMA, who can actually go out there and work with the National Guard, and let's build some additional hospitals or makeshift hospitals that can provide some care locally to where people need it. So as he actually signs executive orders allowing the public-private partnerships that are necessary to help some of these companies that have their factories in place so they can now start, instead of making certain things, convert their factories to making masks, making protective equipment, making ventilators. And so moving that along, signing legislation and pushing legislation so we can get relief for people who are losing their jobs, who might lose their homes, who are renters, who may not have a job now to pay their rent, and then where they're going to go. So those kinds of things are positive, and he's listening at this point to the leadership and his people around him to really do the right thing in this way to push those types of legislation funding that will be necessary to help this huge crisis.
I had heard about that, Doc, about the having the National Guard actually go in and build.
Yes.
Yeah. What's your opinion on that?
I mean, I think there are places where we know we need help. If you look out in Washington State, for example, where they had the first case back there in January, they knew at that point. So the health, community knew when they had 1 or 2 cases that it was going to escalate. So you want to get on top of that, assess what kind of resources you have within the hospital association there, be able to identify places that would be good to actually put up some additional facilities, testing facilities, treatment facilities. Same thing is true in other states like New York. And so I think that the National Guard and their ability to mobilize quickly and build facilities that can be utilized like we do around the world.
Yeah.
We build these around the world. So we have the technology, we have the knowledge, we have the capabilities. We have to have that preparedness and put those things into action. And it's better to, in these environments, it's better to have more and so-called overreact, because I've heard people saying, we don't need to do this distancing, we don't need to shelter at home. Well, my God, you certainly do, right? Because if you do it for yourself, you're doing it for other people as well. And we have to think about everyone in this environment, and let's use all the resources we have. Because if you're aggressive early, you can really try and what they call bend that curve, decrease the number of new cases, right? And shut this thing down. But yet we all have to be responsible. We all have to work diligently and use all resources that we have available.
It sounds as though, and I totally agree, that the National Guard building hospitals would be a great job for them.
That's right.
Yeah, I think it'd be great.
Yeah. They have the ability, they have the know-how.
Right.
It puts them out there, and we in the health profession need it. We are at risk. There's something like 70,000 sort of ventilators around here. We need more ventilators, and we need them in facilities, not only just in our hospitals, but we can have dedicated places where we have people who may have coronavirus and kind of isolated and limited. Because remember, in our hospitals today, we still have people having heart attacks, Cliff, who need to come in, and strokes and other infections who need to come to the hospital too, right? Yeah. So it's not just for corona. So we have to have capacity for the entire population who unfortunately may still get sick, right, with other things and not just corona. We have to take care of them as well.
Mm-hmm. Yeah. Leo, I recall being in hospital when I said, oh, my goodness. You know what I'm saying, right?
Yes.
Yeah. Because of different circumstances, but still, you need the help wherever you can get it. And
wherever you can get it.
Right. And when people know what to do, those are the kind of people that we certainly, want to make sure that things work out. The things that you do because you're a physician. I mean, you know what to do. But there's so many people who just have no idea. What's the next thing, Doc? That let me mention the call-in number too: 312-374-8130. What's the next thing as you see it that should happen?
So the next things are, one, continue to track the numbers and make them available to everybody, and people paying attention in your local communities and paying attention to what your local health departments are asking you to do, and to please to do it. Because if over the next 2 to 4 weeks, if we all really hunker down, we can stop the virus in its tracks, because if you're not connecting with other people and spreading it, the virus has nowhere to go. Your body clears it, or if you're sick enough, you go to the hospital, and God willing, you can get better. So really, really pay attention and hunker down. That's really important. And wherever you are, use, physical distancing of six feet when you can. Wash your hands frequently. This are the basics, but they go a very long way in something like this. We're going to make sure that people who have symptoms are getting tested so we can really track where that virus is and where it might be moving and how we can contain it, because we know where exactly it is. For our veterans, please go to va.gov. Make sure that if you have appointments coming up, that you can actually have those appointments as telehealth appointments. So if you still have other problems, may not be corona related, we still want you to stay connected, and we don't want you to have to come into the hospital unnecessarily. So that's really, really important. I'm also concerned about other veterans who may be homeless, right? And some of our homeless veterans are plugged in to the health system, and some of them are not. We want to make sure we're not turning anybody away, okay? So you see a brother or sister on the street, if they're a veteran, we want to make sure that they can actually get whatever benefits and health services that are available at our VA. We're not turning folks away. We need to make sure we think about those veterans as well.
So notwithstanding, Doc, the fact that someone is homeless, there's still the ability to help them.
That's absolutely correct. Right, and they need to know that. I want them to hear that.
Yeah, that's what I.
Yeah, that's right.
Yeah. How do they do that?
Well, some of them may not have the same access. They're not going to have the internet access necessarily, right? But many of them have. There are social workers around VA, around the country, who know many of the veterans out there, and have given them contact information for them, coming to our medical centers, and actually being able to be seen there and screened and talked to, and then being able to be plugged in to resources that we have for housing, vouchers and the like, that might be important. We don't want to literally leave them out in the cold. There are ways to actually get veterans housing. So we want to make sure we have that broad net that's out there that does exist, and make sure they know that they can in fact be taken care of.
That's right. So no one, Leo, no one should be left out.
There you go.
Yeah.
Leave no one behind.
No, leave no one behind. That's what we've always said. You just do a great job. You really do. We just appreciate you so much. You want to give us a quick close?
Did you have it?
Yeah. Did you want to give us a quick close?
Oh, yes, certainly. Yeah. So, one, I just can't thank you enough for all the work that you do for veterans broadly, for giving at least me an opportunity to connect with the veterans and make sure that they know how much the VA has been, in my opinion, taking a very robust approach to the care that we can offer, and using things like telephone and telehealth that the VA has been a leader in. This is going to transform, I think, around the country of how we do healthcare, and we've been a leader in that way, and to make sure that veterans understand that if you do need to be seen, we are here for you, and use our website thoughtfully. It has a lot of great information out there, because I couldn't go through everything.
Sure.
But please stay safe, stay healthy, stay connected through this crisis, and supporting each other.
Okay. We're going to take a quick call, Leo, okay?
Good.
Okay. Let's go to Henry. You're on WVON, America's Heroes Group.
Yes, hello, Cliff. Greetings to your guest. I was just wondering that all the shortages for hospitals being overcrowded, could you possibly convert some of the closed schools that we have into makeshift hospitals?
Yeah, no, that's a wonderful idea. As Cliff and I were just talking about building new hospitals to make sure they meet some of the criteria that we need to try and keep things safe. But I'm sure that there may be local health departments looking at some of these schools as opportunities to use them. That's a great idea. There may be people taking advantage of that, and I think they should.
Great question, Henry. Thank you so much.
Okay.